Hello, welcome back to Pharma Training Solutions. Today I will be briefly explaining the parasympathetic nervous system pharmacology. We are now in the autonomic nervous system. The main neurotransmitter is acetylcholine, both at the pre- and postganglionic neurons. Acetylcholine is synthesized. I'm sure you are aware of that diagrammatic representation, which is available in the books. It is synthesized from acetyl-CoA and choline by choline acetyltransferase enzyme. Now, after synthesis, it is actively transported into the vesicles for storage by the vesicle-associated transporter, or the VAT. This one can be inhibited by a drug called Pharmaceuticals. Now, during released from the vesicles by extracellular calcium. Now, of course, this one, we are meaning the action potential. I'm sure you're aware of that process. Now, botulinum toxins prevent release. However, the venom increase the release. Now, the termination of action is mostly by the acetylcholinesterase enzyme, and however also by the pseudo enzyme called butyrylcholinesterase. So these two enzymes, one is the pseudo, so is the main enzyme which metabolizes acetylcholine. Of course, after metabolism, the choline is recycled. Let me talk about the receptors, or the cholineceptors. Remember, this is a short presentation. Now, of course, we have the muscarinic receptors, which are the G protein linked receptors. By G protein linked, meaning, I'm sure you're aware of this. This is now pharmacodynamics, which is also present in our preceding discussion. Now, M1 is this one, of course, located in the nerve endings of autonomic ganglia and in the gastric gland. M2 in the heart. M3, this one is located in the visceral smooth muscle, the iris, or the ciliary muscle, and the exocrine glands. We also have M4 and M5 receptors. Now, we also have the nicotinic receptors. Of course, these are the ion channel receptors. These are the neuromuscular junction. These are the skeletal muscle, and of course, in the autonomic ganglia. I'm sure you are aware of all these, because at least you have to know the receptor subtype and the location. And before I go further, all of us know that the parasympathetic is the calming system, because sympathetic is the fight and flight. This one is you calm down. Now, let us look at the direct acting cholinomimetics, or when they bind to and activate the muscarinic or nicotinic receptors. We also have examples of the choline receptors, such as acetylcholine. This one, of course, is the one which is natural. However, it has a short duration of action. It is rarely used. Can easily be metabolized. The other one is carbaco. All these ones have a muscarinic and nicotinic receptor effects. However, bethanical and methacholine, they are selective to muscarinic receptors. In naturally occurring direct acting cholinomimetics, we have muscarine, pilocarpine, and nicotine and loberin. Sure, you are aware of those. Now, let us first briefly explain the effects of the muscarinic. Why, if antagonists attach on the muscarinic receptors, what happens? Also, I've said that in the heart, at the M2 receptor, we have decrease in the heart rate, or negative chronotropic, decrease in the contractile strength of the atria, or the negative inotropic. All of it is negative, as I have said that the parasympathetic is the calming system. It calms down the body. But sympathetic is fight and flight. Energy. This one is energy reservation. Now, in the eye, they stimulate the contraction of the ciliary muscle and the iris sphincter, leading to miosis, or draining of the anterior chambers of the eye. Now, in the GIT, they increase smooth muscle contraction and peristalsis. Urinary tract bladder, they stimulate the detrusor muscle, leading to contraction and relax the trigonal and sphincter of the bladder. And also they stimulate the circulation, such as sweating by sweaty glands. They stimulate also contraction of the smooth muscle in the bronchiole, leading to bronchospasm. Are you getting it? Here via the M3 receptors. This one is very important. When we reach asthma, we shall talk about the drug which is used there. Now, the nicotinic action at the skeletal muscle, activation of the neuronal muscular end plate, this is out in the contraction of the muscle. Sure you're aware of this. Ensure at least you're aware of the actions, the physiological action, because these are the form basis of the pharmaceutical uses. Now, which are the pharmaceutical uses? Of course, one is bethanical, which can be used in non-obstructive urination. Carbaco is used in a magnetic agent and to treat glaucoma. Also can also be used in post-operative areas. I'm sure you're aware of this. Pilocarpine is used in lowering of the intraocular pressure. Nicotine as a patch can be used in in the smoking cessation. Now, what are the side effects of all the direct acting cholinomimetics? One is sweating, lacrimation, salivation, flushing, decreased blood pressure, diarrhea, and bronchospasm. Now, the indirect acting cholinomimetics, of course, this one they inhibit the acetylcholinesterase, the one which breaks down the acetylcholine. Now, they can also inhibit the pseudo enzyme, the butyryl cholinesterase, which are those that can be classified as reversible inhibitors, or the carbamates, physostigmine, neostigmine, and rivastigmine, and the irreversible inhibitors, or the organophosphates, ecothiophate, parathion, and diacinone. Now, these are very many others. The serine gases, all those ones, they are found here. Now, what are the effects of these cholinomimetics? Remember, at the skeletal muscle, because they increase the contractility, and can be used in myasthenia gravis. Now, however, the other effects are those ones above in indirect acting, because they increase the acetylcholine at the receptors. It's not broken down. Hence, all these effects are exacerbated. I don't know if I pronounce it well. Exacerbated effects of the above. But this one is the most important one. Increased contractility, hence used in myasthenia gravis. I'm sure you have myasthenia gravis. You can search about it. Now, how do you manage these? Because most of they are toxic drugs. Because the first one is decontamination by removal of decontaminated clothes and washing of the skin in the tracheal tube and intubation for artificial respiration. Atropine blocks peripheral muscarinic effects. Also have pralidoxime, diacetamonoxime, or bidoxime used in the regeneration of cholinesterase enzyme, used on the aid in regeneration of cholinesterase enzyme. However, you can also use adjunct therapy to manage the other important symptoms, such as anticonvulsants to manage convulsions. Let's go to the antagonists, the muscarinic antagonists. Remember, these are all short presentations. I'm sure you have the well-structured work with you, but I'm sure after you reading this, you can go and gain more information. Also, they reversibly block the muscarinic receptors. The examples of atropine, scopolamine, itrapatropium, parasympine, the cycloamine, or trihexyphenidyne. This is the Aten, benzotropine. All these could be used. Now, which are their effects? Of course, they reduce salivary gland secretion and GIT motility, bronchodilation, and reduced bronchosecretions, relaxation of the bladder and ureter, leading to slow voiding or urinary retention, inhibits the contraction of the pupillary muscles, resulting in dilation and mydriasis. Also, this leads to increase in intraocular pressure, hence glaucoma, and suppress sweating. Now, remember, these are now the opposite of the other first effects of muscarinic agonist. Which are the therapeutic uses? Of course, we know that, as I said above, allotrope is an antidote in organophosphate or mushroom poisoning. I used the management of Parkinson's disease. We know tetrahexyphenidyl is the management of Parkinson's disease. Scopolamine, this one is a transdermal part used to control motion sickness in sensitive individuals. They can also be used as pre-anesthetic medication to decrease salivation. And then it can be used in hyperhidrosis or in people who have problem with excessive sweating. Ipratropium is used in COPD and bronchial asthma. Why? Because it can lead to bronchodilation and also can decrease the bronchial secretions, as I said above. The side effects, of course, is dry and hot skin due to decreased sweating, dry mouth, blurred vision, and acute glaucoma. The ganglionic blockers, we have the non-depolarizing competitive antagonist of ganglionic nicotinic receptor by these are the act by blocking the nicotinic ionic channel. Are you getting it? We have the non-depolarizing antagonist of the ganglionic nicotinic receptor by blocking the nicotinic ion channel. Examples of tetraethylammonium, hexamethonium, trimethophan. Now, the others, such as nicotine, it is first a stimulant or depolarizing, and then due to sustained stimulation, it leads to block. Agents such as nicotine initially stimulate the ganglia and then block them because of persistent depolarization. Are you getting it? Now, I'm sure you're aware of the side effects and a lot of information. Remember, this is a short presentation. Let me go to the neuromuscular blocking drugs. Now, these ones we have a non-depolarizing relaxant. They act at the nicotinic receptor by competing with acetylcholine and then block the pre-junctional sodium channels. Examples have tuberculin, mivacrolin, vacrolium, pancrolium. I'm sure you are aware of the side effects of all these medication. You can refer to your notes or you can contact us for more information. Also have depolarizing relaxant agents. Succinylcholine binds to the nicotinic receptor to open the channel and cause depolarization, but repetitive firing leads to flaccid or paralysis. And now this is the block used to achieve adequate muscle relaxation in surgical procedure, especially when they are going to do laryngoscopy or intubation. That first relax these skeletal muscles. Remember, this has been a short presentation on parasympathetic nervous system pharmacology. Always refer for more information. Next one is sympathetic. You can refer to it. I always remain Wilson from M Pharma Training Solution. Subscribe to the channel in case you haven't subscribed. Contact us for more information on our email or WhatsApp. Leave a comment at the end. Like the video. Share with your colleague. Thank you very much and stay safe.